Hello everybody, Dr. Jeff Lynch here with McKinney and this is Dental Implant Talk. Today I'm going to answer the question, what exactly is a dental implant? Well, basically a dental implant is a man-made tooth root that we build a man-made tooth or a crown on top of. Generally we'll make it at about 3 or 4 months after the implant's placed. This is a large-scale model. What we have here is a titanium screw. This is the dental implant. That's the crown and the abutment. When it's done, we have a tooth that works like a tooth, looks like a tooth, feels like a tooth, and you clean it like a tooth. So why would you want to replace a lost tooth? What is the benefit? Well, first, it allows you to continue to chew efficiently. When you end up with a space from a lost tooth, the neighboring teeth can drift. The back teeth are going to want to slide forward. The top teeth are going to want to drift down. That's going to affect all of them in the chewing pattern. It's going to add extra wear and tear on them. They can chip and crack and break, and you can eventually lose more that way. Losing a tooth is also going to affect your smile. Affecting a smile, people who don't smile or they hide their smile, it affects your self-confidence and your self-esteem. It affects how people perceive you. People who have a bright, big, friendly smile are perceived as being friendly people. People who are frowning all the time and never smile, people feel like they're mean or they're not as nice. Another thing that having an implant does is it helps preserve the jawbone. When you lose a tooth, the bone around where the tooth was will start to dissolve. Literally, about 50% of it goes away in the first 3 to 6 months. So having an implant is going to preserve the bone there, and it's going to preserve the bone around the neighboring teeth. So, to recap, a dental implant's a man-made tooth root that we build a man-made tooth or a crown on. I hope this answers your question. Look forward to seeing you at McKinney